हाय डॉक्टर परवीन, थोड़ा सा
So this session has been scheduled to share some information on the case reports we have in our various journals and some measures we can take as clinicians to help the government as well as general people. So let's start with it. COVID-19, a global health pandemic, as it was declared by WHO on 11th of March 2020. We'll start this with a case report from NEGM. It was the first case of 2019 novel coronavirus in the United States. The case report is as follows. There was a 35-year-old male who presented with a 4-day history of cough and fever, 2-day history of nausea and vomiting. He had a travel history of a trip to Wuhan, some business trip. He was a non-smoker and there was history of hypertriglyceridemia. On physical examination, his body temperature was 37.2 degrees Celsius, blood pressure was 134 by 87 mm of Hg, pulse was 110 beats per minute, and respiratory rate was 16 beats per minute. Oxygen saturation was 96% while the patient was breathing ambient air, and on lung auscultation, bilateral bronchi were present. This is the chest radiograph on day 4 of illness. We can see both the views, and there was no thoracic abnormalities were noted. Lab results, there were basic labs were run on the patient, and on the hospital's days 3 and 5, that means for illnesses days 7 and 9, on complete blood picture, there was leukopenia, mild thrombocytopenia, and elevated levels of creatinine. Liver function was done, which showed elevated alkaline phosphatase, alanine aminotransferase, aspartate aminotransferase, and lactate dehydrogenase. Blood culture showed no growth up to date. Then days 6 through 9 of illness, vital signs were stable, but intermittent fevers and tachycardia was present with the patient. The patient had non-productive cough and was constantly fatigued. On hospital day 2, patient passed a loose bowel movement and there was abdominal discomfort. And there was an episode of second loose stool that was reported overnight. Then various samples were collected for reverse transcriptase PCR testing, that were stool, and among respiratory specimens, nasopharyngeal and oropharyngeal specimens were taken, and serum sample was also taken. On results, stool and respiratory specimens both were positive for SARS-CoV-2 viral RNA, whereas serum was negative. This is the chest radiograph for illness day 9. Here we can see left basilar opacity was visible, arousing a concern about pneumonia. Then on day 10 of illness, a repeat chest radiograph is done, and here we can see on the left side, there's stable streaky opacities in the lung bases were visible, indicating some atypical pneumonia. These opacities were steadily increasing in density over time. On the management perspective, they started with supportive treatment, that is acetaminophen, ibuprofen, guanifenicin for cough, and normal rehydration was done with 6 liters of normal saline during the first 6 days of hospitalization. On the evening of day 5 of hospitalization, the patient's oxygen saturation dropped to 90% while he was breathing ambient air. So on day 6, they started on supplemental oxygen delivered by nasal cannula at 2 liters per minute. For concern of hospital-acquired pneumonia, vancomycin and cefepime was started. On day 7, post-RT-PCR results, a new antiviral which has first been used in SARS and MERS, that is intravenous remdesivir, was started with no adverse effects. On day 8, patient's condition improved and the patient was stable, but he was still kept in the hospital for further isolation and quarantine. I have a study, this was published in the Oxford Journal about COVID-19 in the pediatric age group. This is a retrospective study that examines 10 children diagnosed with confirmed COVID-19 between 19th Jan and 13th February 2020 at the Children's Hospital, Shanghai. The age range was 3 months to 11 years. None had comorbidities and there were no severe cases. Clinical features, we need to know that the assumed incubation period, that is time from exposure to the index case to developing symptoms, was between 2 to 10 days. Usually for SARS-CoV-2, as per now, it is between 2 to 14 days. When in this study, we got to know that 7 out of 10 children had fever, which was more than 38 degrees Celsius. 6 out of 10 had a cough. 4 out of 10 had a sore throat, 3 out of 10 had a nasal congestion, 2 out of 10 had rhinorrhea, and 2 out of 10 were sneezing. On radiological examination, the chest X-ray was normal for 6 out of 10 children. The rest had unilateral opacity. On blood examination, blood counts were normal, lymphocyte counts were normal in 9:10 and raised in 1 case. CRP range was from 0.5 mg per liter to 35 mg per liter, but was less than 10 for about 7 cases. Procalcitonin levels were normal in all children, and 2 patients had a mild elevation of ALT and AST. Detection of SARS-CoV-2 was done, and virus was found in the nasopharyngeal throat swab in all the patients, and the duration of shedding ranged from 6 to 22 days. Stool shedding was prolonged over 30 days in 1 patient. No urine was positive and no serum was positive. This is an article that was recently published in Lancet journal, and that is about a contingency plan for the management of 2019 novel coronavirus outbreak in neonatal intensive care units. As of now, we don't have a proper treatment guidelines by CDC or WHO in case of pediatric age groups. So this was a panel that was given in this journal for basic screening and basic precautions we need to take in neonates. Standard precautions are always there, which include signage at the entrance, strict hand and respiratory hygiene, daily cleaning and disinfection of the environment, and provision of gloves, masks, and goggles for all the medical staff. Additional enhanced contact precautions and respiratory droplet precautions include patients' own dedicated equipment, limited parents' visits, gown and glove change after procedure, and opening window regularly to change the air. This point has to be emphasized on, that avoid breastfeeding from mothers with probable or laboratory confirmed COVID infection until the recovery of confirmed mothers or rejection of probable infection. Medical waste should be taken care very seriously, as there has been prolonged stool shedding in lot of patients. Medical waste generated during medical service should be collected into a double-layer infectious waste bag, which should be treated with chlorine-containing preparation for at least 10 minutes, then disposed of in the same way as infectious medical waste. Then there should be terminal disinfection of the patient's room, is preferentially done using hydrogen peroxide atomization or a chlorine-containing preparation spray. The same journal also chalked out a little bit of treatment in case there's a patient admitted in a neonatal ICU. You can start with antimicrobial drugs, but it should only be prescribed to patients with probable or confirmed bacterial infection. Empirical use or overuse should be avoided. For neonates with acute respiratory distress syndrome, high-dose pulmonary surfactant replacement should be done. Nitric oxide inhalation, high-frequency oscillatory ventilation might be effective. Intravenous glucocorticoids or immunoglobulin could be in some difficult cases, but as of now, the use of corticosteroids has been discouraged by WHO. In critically ill neonates, continuous renal replacement and extracorporeal membrane oxygenation could be implemented if necessary. Those who have no fever for at least 3 days and improved respiratory symptoms, resolution of previously abnormal chest radiography findings, and a series of 2 nasopharyngeal and nasal swabs negative for 2019 novel coronavirus at least 48 hours apart could be discharged home. So these were the case reports. Now let's start with the general COVID-19 introduction. A novel coronavirus, officially known as severe acute respiratory syndrome coronavirus, emerged in Wuhan, Hubei Province, China in December 2019. In humans, several coronaviruses are known to cause respiratory infections ranging from common colds to more severe diseases such as Middle East respiratory syndrome, which happened in 2012, and severe acute respiratory syndrome, which happened in 2002-2003. The most recently discovered is coronavirus that causes coronavirus disease COVID-19. It belongs to a single-stranded enveloped RNA virus belonging to the beta genus of coronavirus family. On March 11, 2020, it was declared a pandemic by WHO. Going by the current world scenario, the total number of confirmed cases have gone up to 4,22,915 with 18,915 confirmed deaths. More than 196 countries have been affected by it. Current epicenter has shifted from China to Italy, with total confirmed cases being 69,176 and death count to 6,820. Going by the Indian scenario, as of today, we have 595 confirmed cases, 545 of them are active, 40 have recovered, and 10 has been dead. As per state, if we go by state-wise distribution, Kerala and Maharashtra are topping the charts in having maximum number of confirmed cases, followed by Karnataka and Uttar Pradesh. Punjab as of now has 29 confirmed cases. The trends show that there has been an increase in the number of confirmed positive cases despite being strict measures on travel. The spread is right now mostly in the stage 2. That is usually those who are positive, that is those who have a history of travel or the contacts of positive. Now, we go to how does it transmit? Person-to-person spread, it is well known about. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, that is within about 6 feet, through respiratory droplet produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Droplet transmission is the foremost route of transmission. Can someone spread the virus without being sick? There have been reports depicting asymptomatic carriers as well, though the people are thought to be most contagious when they're symptomatic. Some spread might be possible from asymptomatic individuals. There have been reports of uttering this with the new coronavirus. But this is not the main way. Spread from contact with contaminated surfaces. It may be possible that a person can get COVID-19 by touching a surface or an object, and then subsequently touching their own mouth, nose, or possibly their eyes. Now, there have been a lot of debate on the alternate routes of transmission. This article had been published in NEJM that gave an insight on the aerosol and surface stability of SARS-CoV-2 as compared to SARS-CoV-1. SARS-CoV-2 is similar to SARS-CoV-1 in a lot of aspects, but it was considered more stable on plastic and stainless steel than on copper and cardboard, and viral virus was detected up to 72 hours after application to these surfaces. Our results indicate that aerosol and fomite transmission of SARS-CoV-2 is plausible since the virus can remain viable and infection in aerosols for hours and on surfaces up to days. But as per recent WHO guidelines, it has been ruled out that there is any airborne spread that is related to COVID-19. Another aspect to this was fecal oral transmission. I'll again quote the first case of novel coronavirus in the United States. As we all know, the patient presented with 2-day history of nausea and vomiting. And also there was viral RNA detection from the stool samples. And also there was a study that supported this fact that 10% patients in Wuhan had also experienced GI symptoms. And the same study also depicted that there have been the viral shedding, the virus has been detecting for a longer period in the stool sample as compared to respiratory samples. Now, if we go by the symptoms, the commonest symptoms are fever, tiredness, and dry cough. The exact chronology is not known, but fever, these are the most common ones. Other symptoms can include shortness of breath, aches and pains, sore throat. Few people have reported diarrhea, nausea, or a runny nose. For diagnosis, for initial diagnostic testing, CDC recommends collecting and testing an upper respiratory nasopharyngeal swab. Collection of oropharyngeal swab is a lower priority, and if collected, it should be combined in the same tube as the nasopharyngeal. Collection of sputum only for patients with productive coughs. Induction of sputum is not recommended in COVID-19 patients. All of these tests are real-time reverse transcriptase PCR diagnostic panels that can provide results in about 4 to 6 hours. Prevention is the foremost in COVID-19 since there is no known therapeutic interventions to control this pandemic. You can reduce your chances of being infected by spreading COVID-19 by taking very simple precautions. As we all know, hand hygiene, social distancing, avoiding touching eyes, nose, and mouth, and making sure and the people around you follow good respiratory hygiene. This means cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Stay home if you're feeling unwell. If you have fever, cough, difficulty in breathing, seek medical attention. Hand hygiene also plays a very important role. Wash your hands with soap and water for at least 20 seconds, or use an alcohol-based sanitizer or a hand rub. Prevention is utmost when there is no cure. And right now we have no cure to this pandemic. So the most important thing to do right now is to flatten the disease curve. How can we do that? The foremost thing to flatten the disease curve is social distancing. That is maintaining a distance of minimum 1 meter. And social distances has a math associated to it. At this point of time, on an average, if there is one person and he does not practice any social distancing, he can infect up to 2.5 people in 5 days and about 406 people in 30 days. And if there is 75% less exposure, then one infected person can infect about 0.625 people, and in 30 days, only 2.5 people will be infected. So social distancing is the only utmost and the foremost thing that all of us need to practice and encourage everyone else to do that as well. As far as hand hygiene is concerned, 20 seconds of hand wash, hand sanitizers can be used, or just wash your hands with soap and water with proper technique. Is there any role of specific food drinks in the treatment of coronavirus infection? There is no specific recommendation, but it is advised to take immune-boosting foods that may include fruits, vegetables, and foods which are enriched in vitamin C and zinc. There have been a lot of controversy about who should wear a mask. Persons having no symptoms are not to use the mask. Medical masks should not be used by healthy persons who are not having any symptoms because it creates a false sense of security that can lead to neglecting of the essential measures such as washing of hands. Am I audible to all?
Yes.
Yes, ma'am.
Okay, thank you. In such a situation, we need to have more effective steps like hand hygiene, covering the face while coughing or sneezing, and refrain from touching face, mouth, nose, and eye. Also, there have been a lot of debate over which masks are better, the regular surgical three-layer masks or the N95 respirator. There have been a lot of studies which have and randomized controlled trials to see which are more efficacious. And most studies, the results were that in community, in major population, there was no difference in the efficacy of both. So you can use any kind of masks, but healthcare professionals who are working for COVID-19 care in hospitals are preferred to use N95 respirators if available. This is a management algorithm that was given by AIIMS New Delhi. If you see any COVID-19 suspect, that is any patient with acute respiratory illness, fever with at least one of the following, that is cough or shortness of breath with history of travel to affected countries in at least 14 days, or a close contact is laboratory confirmed case, or a healthcare personnel managing respiratory distress. If there is an asymptomatic traveler or a close contact as well, the patient should be home quarantined, and twice daily self-monitoring temperature should be assigned to that person, and contact and droplet precautions should be taken. If there is a suspect and we think it's a mild case, that it is low-grade fever, cough, malaria, then treatment options we have is we can give oseltamivir 75 mg BD for high-risk influenza patients and add antibiotics and give symptomatic treatment with paracetamol. In moderate to severe cases, we need admit and we need the testing to be done. This point of time, the only treatment protocol we have is supportive treatment, and though there's some drug trials undergoing. And if the patient tests negative, that goes to the existing protocol. And if it tests positive, then oxygen supplementation should be done, antipyretics, antitussives. NDI is preferred over nebulization. Hydroxychloroquine is a much debated drug, but ICMR has started it as a prophylactic version for healthcare personnel and for close contact. But you have a patient, hydroxychloroquine 200 mg BD for 5 days. It can be considered. Same is the case with lopinavir and ritonavir. It is still under trials, but it can be given on case-to-case basis. Do not combine hydroxychloroquine with lopinavir in view of drug interactions. Corticosteroids are to be avoided. If the patient is worsening, shift to the ICU and non-invasive ventilation or high-flow nasal cannula to be used carefully in view of aerosol generation and ventilator management as per ARDS protocol. Conservative fluid management is must and standard care for ventilated patients. Close contacts should be educated on all the possible precautions they need to take. After clinical and radiological improvement, the patient can be discharged if 2 samples are negative at least 24 hours apart. Now, which are the drug trials that are in progress? A trial of lopinavir and ritonavir in adults hospitalized in severe COVID-19. Remdesivir is a new antiviral, and Mass General Hospital and NIH, United States, are carrying a trial on this currently. And chloroquine does it effectively inhibit the recently emerged novel coronavirus in vitro? In vitro, it has shown an antiviral effect. It has an immunomodulatory effect as well, due to which we use it in rheumatoid arthritis and SLE as well. So, and it also acts, it also inhibits the glycosylation of phase 2 receptors, which are considered the main receptors for novel coronavirus entry. There have been trials going on tocilizumab as well, and then hydroxychloroquine plus minus azithromycin is also being considered as the treatment. ICMR guidelines for the use of hydroxychloroquine for healthcare workers involved in the care of suspected or confirmed cases of COVID-19 is 400 mg twice a day on day 1, followed by 400 mg once weekly for the next 7 weeks to be taken with meals, And if they're asymptomatic household contacts of laboratory confirmed cases, 400 mg twice a day on day 1, followed by 400 mg once weekly for next 3 weeks to be taken with meals. Self-medication is strictly not advised in any other people because there are side effects associated to it and significant side effects associated with people who have cardiovascular comorbidities, since it causes QT prolongation and torsidis equine. So right now it is also under trials, and this is also being given by ICMR as experimental basis on healthcare workers and asymptomatic household contacts. There have been various measures that have been taken by the Indian government. Government is taking stringent measures, as we all know that our country is in lockdown for the next 21 days. Janta curfew was witnessed on 22nd March 2020. All international flights arriving have been prohibited. Isolation wards and quarantine centers are set up all across the country. All OPD services and elective surgeries have been suspended. And ICMR has also now approved 25 private labs for testing with the price capping at Rs 4,500. Extensive contact tracing in the case of positive patients is done because it is still believed that India is in stage 2 of this pandemic, and if we control it in this stage, then stage 3 won't happen, that is a community spread, which is very dangerous in a country is as densely populated as India. So stay home, stay safe, be careful, not fearful, and thank you, and do the fight to help the coronavirus. Wash hands often, elbow cuff into it, face that don't touch your face, feet stay more than 3 feet apart, and if you feel sick, please stay home. Stay home, stay safe. Thank you. In case anybody has any doubts related to anything, I'm open to answers.
Before that, I would request everyone to please start the video so that we can interact.
Okay, ma'am. Okay.
Please interact. If anyone have anything to say about this, please share.
Any comments, any inputs?
What
Hello,
is
am I audible, Dr. Harnoor?
Yes, ma'am.
Am I audible?
Yes, ma'am.
Yes.
Yeah, hi, hello, Dr. Harnoor. It was a very informative talk, and I think it will benefit us greatly now that you have introduced us to the guidelines, especially that are there in treating these cases, etc. So also, I wanted to know if anybody from the Northeast is here from Manipur, because there were some reports that there are some drugs being used there by the Ayush department, arsenium, album, etc. I do not know what these drugs are, but there are some reports that these drugs have been authorized by the ministry to be used in prevention of COVID-19. So I was wondering if there are any participants from Manipur, so we can confirm that, and of course if there is any other. And Dr. Harnoor, in your review, did you find any role of complementary therapies or anybody who has done some trials on, say, some nasal irrigation, heated humidified air, or anything like that?
And there are a lot of trials which are going on the complementary therapies as well, like steam inhalation, drinking of hot water or hot liquids to stay clear of the secretions and everything, but they have not any specific that has been published over whether these are a must. Currently, the emphasis everywhere is just on social distancing and hand hygiene.
All right, okay.
There was a paper in one journal which has discussed around 100 cases, and there they found some Chinese medicine they have administered, which was more effective in which had better cure rates as compared to the other therapies. So it was about the Chinese medicine.
Okay. So probably we can consider doing some systematic reviews pertaining to prevention, because I do not think we'll be able to do anything on the cure, or we can do that as well.
Yes,
But cure is one thing, but prevention is probably more important, especially for our country, because we have to prevent it from getting converted into stage 3, and we will have to be very fast. So if we can have any input from the Northeast participants, especially I guess there is nobody from Manipur, but I hear John has uh, joined. Can you hear me? No. Okay. John had just joined anyway. Okay. Dr. Kamal has sent a question, any information on comorbidity? So Dr. Harnoor, would you like to take that up?
yes, ma'am. Comorbidities, there have been studies that are done in China which say there has been greater death rate in people with comorbidities, mainly diabetes and hypertension, but there is no authentic evidence to it as such. But more deaths have been reported in people with older age and in people with associated comorbidities such as hypertension and diabetes mellitus, or even respiratory conditions. People who were already suffering from bronchitis or asthma, they also have increased fertility rates in Chinese setup as of
Uh, Ma'am, there is also nowadays a query about the quarantine time for those who have been infected and for those who are suspected. So we can take up that question also to find out the evidence.
I'm sorry, what, Dr. Nishant? The quarantine time, what is
The time for being quarantined in
Okay.
case you are infected and
Right.
in case you are a close contact. So there are some reports which say that 14 days is lesser time to be quarantined.
Oh, okay. Hmm. Yeah, then probably a review is
Yeah.
definitely required to know exactly, because yes, as I think Dr. Harnoor had just told us that even up to 30 days there can be shedding of the
Yes,
virus
they can be.
in the
Yes.
fecal matter.
Fecal matter.
So, there is definitely this point about the duration of quarantine. So there are a lot of questions surrounding this pandemic which probably need to be answered, and we need to look at the literature that has already been gathered and the studies that have been done abroad, because this has come from outside, and a lot of studies from China and perhaps some from Italy or United States, which we should look at and then generate our own evidence. But our evidence will come later. First, we have to look at their literature. So anything else from our other participants?
Ma'am, we really need to give some public health messages also regarding disposal of mask, because I've seen around people are disposing not in a proper manner. So we really need to have, is there some kind of the guidelines for disposal of masks, like whether it is surgical, the other, obviously medical fraternity knows, but what about the lay people? They have been told if they are using the cloth mask, generally they are using it, washing with warm water, then drying it for a while. So is there some guidelines or any scope where we can go for it?
Right.
on an average, a mask should be used for 8 hours and then probably disposed. And there should be a proper disposal that should be done for it. But due to there has been a global surge for masks and sanitizers, and there has been a global supply chain crisis for masks. So to combat these conditions, people have started using cloth masks. So basically, the purpose of the mask is just to provide a barrier for common people. And so this is the main reason it is very important for normal people to know that if you're healthy, if you're home isolated, if you're not in contact with anybody, you don't need to use a mask. So that people who really need them, like the healthcare staff and the people who are constantly involved in the care of COVID-19, they can have an access to it. There has been a lot of miscommunication that everybody needs to wear a mask to protect from COVID-19, which is not the case as of
Right. And adding to that, Dr. Harnoor, there is one more thing about masks, that if you wear a mask, it actually protects the people who are around you. It doesn't really protect the person who's wearing these fitted surgical masks. I do not mean the respirators, but the surgical masks. So point is there, and I think based on that, but definitely disposal of these masks is still an issue. These surgical masks or the cloth masks that we use to protect other people, their disposal is definitely a point which should be taken up as a public health intervention disposed properly, because as we already know, these viruses can survive on these various materials for 72 hours, and we need to combat that. I was wondering, is there a role of disinfection by using sunlight, because our country has a hot tropical climate which probably we can use to our advantage.
there have been
So
studies which say that there is an effect of temperature and humidity on the virus. So probably disinfection would also have a role, I guess.
right. So some more questions again which we can take up for our systematic reviews, and we would encourage the participants from Northeast to definitely take up these questions, because now is the time to utilize all the knowledge we have about conducting these reviews and actually put them into practice.
And temperature and humidity measures are really talked about because the mortality in European cases in US at the rate is higher than the Asian countries. And the only difference that can be mounted upon, despite their optimal healthcare services, is basically the temperature and the humidity variation.
Right.
So that can be a very important question to be looked into.
Good afternoon, ma'am. I am Abhijit from Fakhruddin Ali Ahmed Medical College, Borpeta, Assam. So, ma'am, as far as the test is concerned, real-time PCR test is it a confirmatory test or like sequencing or any other test?
Abhishek?
Yes.
Yeah, your voice is a little bit disturbance is there.
He is trying to ask about the diagnosis.
Am I audible?
Yes.
As far as the test is concerned, ma'am, only real-time PCR, which is a qualitative test, I think, is it a confirmatory test, or if we want to monitor or follow up the patient, is it possible to go for the viral load monitoring also?
Sorry, sir.
Please be clear, sir.
Or just right.
Write it to chat.
Hello.
You can
You
switch
could
on the
type.
video.
Yeah, you could. Yeah.
Yeah, also, or you can type in the chat box.
I think he was asking about the diagnostic methods.
Okay. For right now, PCR is the confirmatory test for this.
So currently, it's just PCR right now we have, but there are efforts to make tests which do that in a shorter time. Like United States has started drive-through testing for patients, which probably gives the results in 45 minutes. So probably when we progress with this, we'll also come up with something. Yesterday in the news, there was that India is also making testing kits which are manufactured in India, and to accelerate the production and also to cut down on the time so that we have faster results.
There was a news that some Pune-based lab has developed RT-PCR
company,
which gives the result in 2.5 hours.
Yeah, 2.5 hours for confirmation. not detection, but the advantage is that kit confirm that this person has confirmed infection of COVID-19. So initially it took 7 hours, which is a detection test first. So that after that confirmation test was done, but this advantage with this kit is that it confirms in 2.5 hours.
Any more questions or comments, doctors?
I think we really need to ponder upon the effective communication strategies also. Somewhere I feel the message was not that effective, like the people who are coming from abroad, they found that if the temperature is fine at the airport, they need not to be quarantined and they were freely roaming. So somewhere we really need that in some countries where, the measures, the effective communication strategies has been able to contain the people in their homes. So somewhere we really need to work or think upon the behavior change communication strategies that has been utilized by the various countries. So I personally feel in our country, because people, when they had their temperature checkup at the airport, those who felt there was no, but the message was not clear that there can be chances of their being infectious even if their temperature is fine at that moment. So we really need to ponder upon this question also, like what are the
Temperatures were normal, ma'am. They were asked to self-quarantine themselves, which a lot of people did not do, and which led to a lot of contacts of their being positive. Then eventually the government started putting the home quarantine stamps, but that were again not investigated whether the patient is home quarantined or not. So that was, I feel, the slag in between, that people were advised so, but the people didn't follow the advice. So a lot of those contacts have been detected positive, where people were landed, they were asked to home quarantine themselves, but they did not. And eventually in the course of 14 days, they developed symptoms and they were positive later. Now the government has started that with any person who has a home quarantine stamp and has been found outside will be arrested. But probably now we have a total lockdown. So that enforcement is foremost.
Okay, so Dr. Kamal has asked a question. Any public health approach for better communication to public for social distancing involving different agencies, etc.? Any study? And Dr. Nishant has asked us about some home quarantine and parenting tips. And Dr. Abhijit is any real-time PCR only? Is real-time PCR only the confirmatory test, or is viral load monitoring possible for patient follow-up as well? Okay, so these three queries we have. So public health approaches for better communication. So Dr. Meenakshi would probably like to take this up.
Ma'am, the message, the most important funda in any public health messages is like the message should be very clear and apparent. That was I was talking. Maybe I think I was not clear in my question. So in our country, I've not seen any study on that. Even I was exploring for the previous diseases, but there was no study, or I did not found any literature on how to communicate in re-emerging diseases, how to have the effective communication. Like Dr. Harnoor just said, like now we have started the stamping, but the people were not aware, like if they are fine at the airport, they were found fine at the airport, they're not supposed to go outside and meet their friends and everywhere, in the city. So right now I am not able to find any topic on this, any people on this.
So
but
there are no real good studies on this topic.
Yeah.
Okay. So that is there. There are no studies, but of course the media otherwise has disseminated the information pretty effectively that social distancing needs to be done. So for that, they have utilized at least the televised media and the telephone, that is WhatsApp, etc., and social media. So that is there. But yeah, since there are no studies, definitely some more research is warranted, and perhaps some of us can take this research question up. So Dr. Nishant has home quarantine and parenting tips. So there is a lot of information and a lot of tips available, again, on various sources like social media and about this question. So I'm sure you'll be able to find a lot of those. You can share your experience, Dr. Nishant, because you have a small kid at home, as have I. So we know this is a trying time for all of us. So you would like to share something?
I'm really trying to figure it out how to maintain the protective, how to follow the guidelines while taking a kid.
Yeah, so I think it's basically what we have to do now is maintain common sense hygiene. So that is wash your hands and avoid touching your face, etc. And same goes for everybody caring for the child, including the child if the child is old enough to be educated regarding these tips. Otherwise, and definitely keep them busy and also keep them informed. But do not create fear or panic in them, but just inform them why, what is COVID-19. It's a, if the child is big enough to understand. Definitely not for very young children, but for elder children, they should be informed. And all the tips that we are following, that is all the measures of personal hygiene, we have to continue those. So there is another session that has to be organized now. So we have to wrap this up, but definitely we'll keep the discussion open on the WhatsApp group or any other medium you find suitable. Definitely get back to us. Dr. Abhijit has asked, is RT-PCR only the confirmatory test or viral load monitoring is possible for follow-up? So this question, if Dr. Harnoor would like to take, as far as I know, RT-PCR is only for confirmation and viral load monitoring is not really done, but RT-PCR is done serially, and 2 negative PCRs consider a patient to be cured. So, and I'm sorry, yes, Dr. Harnoor would like to elaborate on this further, and that will be the last question.
Yes, right. It's just RT-PCR, and two negatives, 24 or 48 hours apart, are enough to tell whether a patient is
right. Right, and viral load monitoring is not really done as of now because we just need to get the, that is as far as we know, right? And so there are many more questions coming up. However, in view of lack of time, Dr. Amit, would you like to, how much time do we have?
We don't have.
We have another meeting.
All right. So it's fine. So we'll probably wrap this up. We can continue this discussion on the WhatsApp group, and these questions we can just probably address on that group, right? Thank you so much.
Thank you so much, everyone.
Thank you so much.